Hello, YouTube viewers. Welcome back to my channel. I am Dr. Tahir, your trusted rheumatologist, obesity medicine, and lifestyle medicine physician. Today, I want to take an opportunity to discuss with you a disease related complications which are important and it's regards to disease called systemic sclerosis. Now, systemic sclerosis or scleroderma has a fear associated with the name. This disease can be pretty severe and can cause life-threatening complications. But fortunately, not all patients have that dreadful fate. I am going to discuss with you today a case of a 67 years old female that has been my patient of systemic sclerosis for many years. Um, this condition offers a lot of challenges to my patient when it comes to her gastrointestinal system, and I'm going to focus a little bit on what to expect. So when somebody has systemic sclerosis, the sclerosis is causing fibrosis of the skin as well as internal organs. And that leads to hardening of the GI system. So the digestive system becomes difficult. This condition can cause gastroesophageal reflux disease. It can cause hiatal hernia and gut motility issue. And my patient has all three of them. In this video, I'm going to touch on her difficulties with absorption of food, the challenges that she faces, and also how this difficulty of absorption of food can lead to other problems such as bone health problems and osteoporosis. So systemic sclerosis or scleroderma is an autoimmune disease that causes hardening and thickening of the skin and the connective tissue. Beyond the skin, it can affect internal organs such as your gastrointestinal tract, your lungs, and other organs. But I'm going to focus on the gastrointestinal part today. So GERD and GI complication in systemic sclerosis happen almost in every patient. Many patients with systemic sclerosis develop gastroesophageal reflux disease due to weakened esophageal muscles, which is the tube that runs from your mouth connecting your stomach to your mouth and the food travels down. This leads to acid reflux and heartburn. This also happens because there's a little sphincter, a muscle that actually contracts when the food goes down and goes into the stomach, and this muscle contracts so the food doesn't come back into our esophagus, and that also becomes weaker. The second problem is hiatal hernia. Now, because of the changes in your anatomy of the GI system, a portion of your stomach, if this is the diaphragm, here is your stomach, here is your esophagus, it comes out and makes a little pocket of stomach uh, coming out of the diaphragm and sitting in your chest wall, causing pressure and difficulty with breathing. And this is part of the stomach that pushes through the diaphragm, can further aggravate the symptoms of gastrointestinal discomfort, such as making your GERD feel even worse. There's also reduced gut motility, which slows the digestive process, causing bloating, discomfort, and difficulty tolerating certain foods. And this can significantly impact the patient quality of life and nutritional status. Now, many of you know somebody who is on one of those medications now. We prescribe GLP analogs, Ozempic, Wegovy, tirzepatide. And you know how they feel when they take that medication and their stomach feels like harder and the food cannot go down and they feel bloated, they feel discomfort. And that also is the reason how these medicines work for reducing weight loss. Well, patients with scleroderma feel that every day. That is their life. So you creating some understanding of what another person goes through is part of another part of medicine. I'm going on a tangent here. Is called empathy. So in any case, dietary modification for systemic sclerosis and GERD, I'm going to discuss that a little bit. So diet plays a critical role in managing a patient for this. For this, my 67 years old patient, we discussed dietary adjustments, which can make a world of difference in GERD and improving gut motility. So here are some key recommendations that I made for her. Small, frequent meals. Eating smaller meals more frequently reduces the pressure on the stomach and it minimizes the reflux. Number two, avoidance of trigger foods, fatty foods, caffeine, alcohol, chocolate, and acidic food, can worsen the GERD symptoms and should be limited. Number three, staying upright after eating. I encourage my patients to stay upright at least 30 minutes after meals to prevent reflux. Fiber-rich foods. So fibers such as whole grains, vegetables, fruits, gut, they promote gut motility. And but you have to be careful. Overdoing this can cause excessive bloating. So you have to start low and go slow. Next, hydration. Adequate amount of water intake is crucial for digestion and gut motility. And last but not least is the calcium and the vitamin D and the minerals and mineral-rich foods. So my this patient also has osteoporosis, so I focused a little bit on foods which are rich in calcium and vitamin D because they can ensure that her bones are not getting weaker. And there will be another video at some time about the importance of foods in osteoporosis prevention, but that's something that I touched with her as well. So now let's focus on a little bit on how do I monitor and assess these patients of scleroderma. Well, regular monitoring is essential, of course, for all autoimmune diseases, including systemic sclerosis. Assessing for worsening GERD, reduced motility, nausea, vomiting, malabsorption symptoms are important because these patients do have malabsorption symptoms. Sometimes I even have to give them an antibiotic to, to treat a what we call SIBO, small intestinal bacterial overgrowth. For instance, untreated GERD and these complications can not only lead to discomfort, poor quality of life, but they can also lead to chronic esophagitis, a complication called Barrett's esophagus, which increases the risk of cancer in these patients. So monitoring gut function is really important for scleroderma patients. And as they are seeing me, I touch on other organ systems too, which I'll make videos some other time, such as heart, lungs, skin, vascular health in these patients is important. So my final thoughts are that for systemic sclerosis patients, number one, working with a physician who has experience treating these patients is going to be the key here. Make them part of your life and your team to help you. Looking at holistically on your health approach is important. Making sure your gastrointestinal health is good, your nutrition quality is good, and you're taking advice on how to help offset any of the complications. In this case, I have a patient who has osteoporosis, so I am giving her Prolia treatment to help reduce her bone loss, which is very common in patients with all autoimmune diseases. So I encourage you to work closely with your healthcare provider to adjust in your treatment, discuss what other things can be done to help improve your quality of life. At the end, if you found this video helpful, don't forget to subscribe to my channel, Youthful Medicine, and please share it with a loved one, a friend or a family who may have scleroderma, osteoporosis, or even need to learn a little bit about it. And subscribe to the notification bell so that you can get notification when I release another video. I am enjoying this part of my work to help patients understand it, and my outreach can be a lot higher and bigger just to help patients improve their quality of life. So stay tuned for more health tips and discussions on autoimmunity, obesity, and longevity and vitality of your health. Until next time, take care of yourselves.